Member for Melton.
Thanks, Acting Speaker. I was just waiting on to see whether the opposition had further speakers. Obviously not. Thank you. And of course, I rise today to contribute to the Health Safeguards for People Born with Variations in Sex Characteristics Bill 2025. And of course, this bill is about children and their health and welfare. And of course, this is not about blaming anyone. This is about greater protection for children, and certainly greater protection for their parents, and support of the parents, and support of the medicos that have to make these difficult or give this difficult advice and decision in supporting the parents and the children. And firstly, I'd like to start by thanking the lived experience advocates from Interaction and Equality Australia, who came to speak to us last year in this place towards the end of the year, and I really appreciated the opportunity to learn a lot more from those members of the intersex community, and to be far more educated about the history of intersex advocacy and the unique challenges that this diverse community faces, and the complexities in regard to this particular issue. And hearing some of the contributions today, and some members making references to, I think, Herald Sun front page stories back in 1983. And it doesn't seem that long ago, but it seems like it was the dark ages, those stories of what was referred to. And I'm pleased that we've moved along, even though it's taken some time. I also wish to acknowledge, obviously, the decades of the advocacy that have led us to this moment of bringing this bill into the House and debating this bill, and of course the needless hurt and trauma that those have experienced in the intersex community over many, many years, and in some cases lifelong trauma for some individuals. And I just want to extend my admiration for the courage that the intersex community have had by coming forward and advocating strongly over many, many decades. It's amazing. And again, it's not only the advocacy, but the education that they've imparted on the community that are ill-informed and ignorant of the circumstances that have affected our intersex community. Of course, there's about 1.7% of people are born with red hair. But I don't know if you know, Acting Speaker, that just as many people are born with variations in sex characteristics. And I think someone quoted before, there's about 1,500 people a year that may be born with variations in sex characteristics. And of course, they're also known as being intersex. And of course, just like how all redheads are different, it's important to remember that there are at least 40. You're all right, member for Morty Alec. I think you actually might have dyed your hair, have you? And, doesn't look as red over here. So anyway, but it's important to remember that there are at least 40 known innate variations in sex characteristics that fall under the umbrella term of intersex. And of course, these variations are natural, and most people will not require medical treatment or surgeries. But unfortunately, many people with innate variations in sex characteristics have been subjected to needless cosmetic surgeries to fit a binary and medicalised view of how the body should look. And again, it's life-changing and traumatic for many, many of our members of the intersex community. Of course, lived experience advocates have told us that these surgeries were often unnecessary, and we know that through some of the contributions today and the advocacy over many years. And they were certainly deferrable, and of course, some of them irreversible. And of course, medicine, is supposed to be that it does no harm, and it's meant to be about making a person's health and welfare better, not, I suppose, in one way, what we would say that some of these surgeries have destroyed some individuals and destroyed their life through the traumatic changes and experiences. And it's caused much harm to many of our intersex community, and certainly affected their health in many, many different ways. Of course, many of those surgeries are deferrable, and they often do not need to be performed on a newborn. And they can be deferred to when the child can be, as the child's growing, or can be informed as an adult and can make a choice about their own body. So you give them an opportunity. It is their body, and they should be the ones that make those decisions with the proper level of information and education around about their, I won't call it a condition, but their situation. Of course, as I said before, these surgeries are irreversible, and once a surgery is done, it cannot be undone, unfortunately. And as detailed in the Equality Australia's Missing Voices report, and I know some members have referred to that, and it's a must-read, many intersex people who have undergone these surgeries and treatments have experienced lasting impacts, as I said. I mean, negative self-image, lifelong pain, the need for further surgeries, the loss of reproductive function, and of course just the ongoing trauma, let alone the mental health trauma and the mental health outcomes for many of these individuals. And of course, for our intersex people who haven't undergone surgeries or medical interventions, these people and their loved ones are often left in the dark with misinformation, or even a lack of education or a lack of information, and minimal to no psychological and peer support. And it's crucial that they should have access to that psychological assistance. Because people born with innate variations in sex characteristics have told us that they want to make their own choices, and they should have the right to do that about what happens to their bodies. It is their bodies, and everyone should be able to make the choice of what happens to their bodies, including being able to give informed consent to medical treatments that will impact them for the rest of their lives. And this bill ensures that people born with innate variations in sex characteristics will be protected from unnecessary medical treatment and harm by introducing, the informed consent safeguards that this bill will do. The introduction of an independent oversight panel is important, and the introduction of individual and general treatment plans is really important. And of course, the consequences for non-compliance with these measures go a long way to protect individuals and support them in their situation. Of course, it means that people with innate variations in sex characteristics will be able to have autonomy over their bodies. It means that parents and guardians of children born with variations in sex characteristics will have access to information and support, and that's crucial. And it will mean that doctors will be supported with clearer guidelines to ensure they are delivering best practice care. And of course, we can't just assume that doctors are well informed, well educated in regard to this type of situation. And we know we have the greatest medicos within our fantastic hospitals here treating our children, but not everyone is an expert in this area. The other thing is about the informed consent. And of course, those measures are outlined with the criteria a person must meet with when a doctor considers whether they have the ability to give consent. And of course, the person and their parent or guardian must be provided with specific information about the particular variation in sex characteristics and what treatment is available, and of course the advantages and the disadvantages, and of course the complications of that, and what treatment may be required into the future. And of course, again, the advantages and disadvantages of deferring or not receiving treatment. But also along with that, and we made reference to it before, and that's the mental health support in regard to all of these aspects of this type of consideration and surgery if required. And of course, the doctor must also consider the individual's capacity, which is really important. I know there's been some great contributions. I just wanted to go to the recent amendments from the opposition. I don't think it's necessary. Clinicians have been involved all the way through the process of formulating this bill. This is a really important bill, and I'm pleased that it's been brought to the House this week. I'm totally supportive of it, and I commend the bill to the House.